Welcome to Brief Case, a video series from OUM where each episode examines a real, closed malpractice case to help chiropractors like you understand what can go wrong, how claims are defended, and what steps you can take to protect your patients and your practice. Today's case involves a chiropractor who was sued after his patient suffered a stroke following cervical manipulation. The patient was a 29-year-old certified nurse assistant with a long history of migraine headaches, nausea, vomiting, and dizziness. She was taking meclizine for these symptoms and also had complaints of neck pain. She had received chiropractic care at the insured's practice twice over an 8-month period for these same complaints. She returned 2 weeks after her last visit, reporting migraines and continued right upper neck pain. 5 days before this appointment, she had gone to the emergency room for severe migraine, neck pain, tunnel vision, sweating, and nausea. During that ER visit, she reported a stiff neck lasting several weeks and noted she had been evaluated by her primary care physician multiple times for the problem. She was later referred to a neurologist who gave her a right occipital nerve injection for her migraine and recommended she see a chiropractor. At the chiropractic visit, the insured evaluated the patient and found subluxations at C1, C2, and C3. Her cervical spine range of motion was limited to 45 degrees in left rotation and 60 degrees in right rotation. The shoulder depressor test was negative bilaterally. The cervical compression test was negative bilaterally. The insured performed a diversified adjustment at C1, C2, and C3. After the adjustment, the patient reported dizziness and difficulty focusing. Her hands and fingers began going numb, and she had difficulty speaking. The insured wanted to call EMS, but the patient refused. Her husband came to the office and drove her to the emergency department. She was diagnosed with a right inferior cerebellar infarct, secondary to a dissection of the right vertebral artery. TPA was administered. The patient filed a lawsuit alleging the chiropractic treatment caused a vertebral artery dissection, which led to an acute stroke. She claimed visual and physical deficits, worsening headaches, difficulty with extended ambulation, imbalance, and fatigue that prevented her from working. Specific allegations included failure to obtain proper informed consent, failure to perform an adequate physical examination, failure to refer for specialty consultation or imaging before initiating cervical manipulation, and use of excessive or improper technique during the adjustment. The defense obtained expert reviews from 2 chiropractors, a neuroradiologist, a neurologist, and a vascular neurosurgeon. Both chiropractic experts felt the insured provided appropriate care. A review of past medical records revealed the patient had a pre-existing vertebral artery dissection that had been missed by multiple providers. The experts felt that while the insured's treatment may have caused a pre-existing clot to dislodge, it likely would have occurred from any number of normal activities involving neck movement. The neuroradiologist found the patient had suffered a VAD weeks before her final visit with the insured, resulting in a mild right cerebellum stroke that typically carries a good prognosis. The neurologist confirmed the patient made a relatively good recovery, and medical evidence did not support her claims of inability to work. The vascular neurosurgeon concurred that the pre-existing dissection developed several weeks before her last appointment. He noted the diagnosis had been missed by her PCP, an ED physician, and a neurologist, which speaks to how difficult VAD can be to identify. He did not believe the insured's treatment caused the dissection, but acknowledged it may have caused a pre-existing clot to break off. The defense team felt the case was defensible on both standard of care and causation grounds. However, there were real vulnerabilities. The patient developed acute stroke symptoms immediately following cervical manipulation, making her a highly sympathetic witness. A verdict could have exceeded the insured's policy limits. The insured chose to settle prior to trial. A settlement was negotiated, and the case was closed. This case is a clear reminder of how quickly a chiropractic visit can become the center of a serious malpractice claim, even when the standard of care is defensible. The vulnerabilities in this case came down to documentation gaps and a failure to recognize warning signs that warranted further workup before treatment began. Before initiating cervical manipulation, perform and document a thorough orthopedic and neurological examination. In this case, there was no objective documentation of those findings prior to treatment. Document both positive and negative findings and address differential diagnoses based on the patient's presentation. On the initial visit, document your clinical assessment, diagnosis, treatment plan, and your rationale for treatment. Reassess the treatment plan throughout the course of care. If symptoms are not improving as expected, consider modifying the plan or referring the patient for additional testing. Obtain and document informed consent prior to beginning chiropractic treatment. That discussion should include the intended benefits, alternatives, and the possible risks and complications. Document the specific treatment performed and the specific location of treatment. This information is critical when defending allegations of improper technique. Finally, be aware of early signs and symptoms of VAD or stroke. This patient had a history of headaches, nausea, vomiting, and dizziness, all of which can indicate pre-existing risk. If you have concerns a patient may be at risk for VAD, refer them for further testing before initiating treatment. These steps will not eliminate risk entirely, but they will position you to defend your decisions and demonstrate that you practiced at the standard of care. To learn more, safeguard your practice, and download this case, visit us at OUMChiropractor.com.